there is a number of parts coming in for installation of that equipment. Sometimes few equipments are small. There is no part. There is one equipment. Like, let's say I say there is a colorimeter. There is only one colorimeter, but along with it, some uh, tubes are coming. Then some, if company is providing you some pipette or some measuring glass extra is coming. So note whatever is coming along with that. Some major equipment, they have many small parts. Let's say LED, it has many small parts. You have to join those parts, then the entire equipment will be formed. So count the number of parts which are coming along with the purchase order or the invoice. So that was the pre-installation requirement. Then ask for an operational manual. So initially hard copy used to come, but nowadays there is no hard copy. Sometimes they say there is a soft copy in the equipment itself. That is for the bigger analyzers. But for smaller equipments, like you are taking some spectrophotometer or you are taking, so ask for an operational manual in which all the guidelines, troubleshootings, maintenance requirements, everything is given in the operational manual. Then procedure of equipment and test. It is also mentioned in the operational manual. If not in the operational manual, company will provide you with the separate, but all tests can be done. What is their procedure and what is then asked for the training package also. If you have a team of 20, they say we will only train to 3 or 5. Then you have to do, or they are ready to train to the entire staff. So this should be confirmed and a certificate of training should be asked once your staff was trained on that equipment. So once this is done, next slide please. Once this is done, then we should move on to the installation of the equipment. Definitely ask how much time it will take. So in installing the equipment, if there are many small parts, it might take a longer time for installation. So a visual inspection, please put on to that installation qualification. Yes. Then a visual inspection of the parts of the equipment along with their purchase order, along with the list of the parts should be done, and then it should be handed over to the engineer. Once it is handed over, then assembly of those parts is required. Engineer will do an assembly, a site preparation, and environmental requirement of for that instrument. He will check the power supply. He will check the documents related to installation. What are the trainings required? Identify it. Just ask for their training manual. Ask for the checklist, what all they will teach in the training, and whether they will be doing a post-training evaluation, and whether any documentation is required. Then ask for the support service, to whom we should contact if there is any problem or if we want to know something about this equipment, the name of that person, the contact number of that person to submit his operational qualification. Once the instrument has been installed, then the operational qualification of the equipment. You should ask for what all they will do in operational qualification. For if you are planning to start, let's say 50 parameters of chemistry on one equipment, what is their procedure to say last slide, and this operational qualification slide, yes. What is their schedule of calibration and what is their procedure, whether they are calibrating initially all the chemistries together or they will be doing for any 5 chemistries. So you should be knowing what they are doing in operational qualification. What is the test manual which you wanted to start on that equipment? What is their procedure of passing that this instrument has passed the operations, that it is working fine. Then what is their maintenance schedule? So to pass the operational qualification, uh, maintenance should be done. So maintenance should be passed. What is the procedure? And it should be passed. Then calibration of all the analytes, or what is their procedure? They will be doing only for 5 analytes. And why they have chosen only those 5? Always ask the question, and then what is their, whether they are doing linearity regression, precision, carryover, any study they are doing, what is their protocol of saying that the instrument has passed the operation process. Check the tested sample which has already been reported. You can check those samples with how many samples they can check. Now, then there is review of this operational qualification. In the third point, we have said that linearity relationship, precision, and carryover. So, uh, for this, sometimes you can see during the audit processes also, and during, in many CMAs, in many, you have seen people are discussing the what is the criteria, what should be the CLSI criteria, what should be the CAP criteria of doing the IQ, OQ, PQ. Basically, it is either OQ or it is PQ. So OQ is operational qualification is what usually the company's protocol of passing this operations is better. Performance is how your machine is performing the on your standards. So in operational qualification, what is the company's protocol? Always ask that, but all they will do for this, whether they are doing linearity, whether they are doing the precision, whether they are doing the carryover, or all the three they are doing, and for how many chemistries they are doing. And you have to provide them the samples. Linearity is you are basically verifying the analytical measurement range of any equipment. From lower detection limit to the highest detection limit, whether the graph is linear or not, and what is the R square value. Then you can check the precision. How precise is your result? How reproducible is your result? Is either you can do inter-assay variation or precision, or intra-assay precision they are doing it. So you have to ask whether they are doing is intra-assay or inter-assay. Inter-assay means the study, the operational study for passing that should last for few days. You have to check the precision, inter-day variation of it. Then carryover. Few equipments, they have disposable tips. So no carryover study is required. But for smaller equipments, where there is a single probe for sample probe and single reagent probe, carryover studies should be done. So just find out the importance of how it is done. You have to take 2 samples, like one low, one high, which has been reported. Run the high sample 3 times in duplicate, then run the low sample in duplicate 3 times, and then see the carryover study, see whether any carryover is there or not. Then compile the report, check it whether this is passing what they have claimed for. So ask for the passing criteria. What is the passing criteria? Means how much variation was accepted. Always ask them to make a complete comprehensive report. All the raw data along with it should be attached along with it, and ask for the passing criteria, that if they are doing 5 tests in operational qualification, what is their criteria? How much variation for each is accepted? Like if they are doing creatinine and if they are doing beta HCG, so criteria will be different. For creatinine, acceptable variation may be 5%, but for immunoassay, it may be 7% or 10%. So ask for the passing criteria of the analytes which they are checking in this report. Operational qualification, tell them to make a report along with the raw data, then approve it and review it and approve it. It should again be signed by the engineer or the application specialist and the authorized person of the lab. They should approve it. This is the operational qualification. Now, next we go to performance qualification. Next slide, please. Per performance qualification. Performance qualification is this you can have your criteria to check the performance of the equipment. Now, yeah. So in this, you have an SOP, standard operating procedure, to verify the performance qualification of the equipment. You can write an IQ will be done, a OQ will be done, and then a PQ will be done. In this, you can use patient sample, you can use your QC material, you can use your EQUAS material, write down a procedure. Even for a smaller equipment, you should do it. Like you are taking a small equipment of Herbachem, you have a small lab for that. How much? You cannot do a comprehensive protocol. You can do little bit things which are covered in operational qualification. You can mention we will be doing the same protocol, or you can mention your protocol like we will be doing accuracy, BRI verification, how many samples you will be doing. If it is a high volume test, more tests can be done. But if it is a low volume test, you are receiving very few samples. So you can define your protocol, how much you will be doing. This is lab's prerogative to decide how much will be doing. If you have already one instrument of the same make and you are taking another second equipment, then you can also say that we will be doing only the inter-instrumental correlation. It's up to the lab to define the protocol of performance qualification. Both IQC and EQUAS can be used. IQC can be done for 10 days. Accuracy can be checked for all the levels, level 1 and level 2. Then equa sample can also be processed and can be checked by the second key. What was your last equa achieved? And what is the, how is this equa performance is, you can evaluate. And if required, it is not behaving properly, or it was I have done an inter-lab comparison or inter-instrument comparison. If it is not done properly, then you can stop the this IQ PQ report, that you need to verify this analyte. Why this analyte is not, you have 20 analytes, operational qualification, you have verified only 5 or 10, but there is another analyte which is misbehaving in IQ and EQUA. You can undergo a complete verification of that analyte on this equipment. Then maintenance, what all is required, what is the schedule of preventive maintenance, whether you will be doing 6 monthly major maintenance or you will be doing yearly monthly maintenance, your major maintenance. Then calibration schedule, you will be doing it yearly. Then repairs is any time if there is any fault in the equipment, then a repair mechanism will be undertaken, whether the personnel in the lab will be trained for some major good troubleshooting, or a company engineer has to be asked this. So key operators should be identified. Who will be the key operators? One of them or two of them should be trained on handling the day-to-day troubleshooting, which can be solved after talking to the engineer. Then make a PQ report in which you have done a BRI verification. If you have done a if you have done precision study, if you have done accuracy study, what is your protocol for low volume test? What is your protocol for high volume test, if any, or protocol is same for any analyte in the lab, irrespective of the sample load. Then you have to verify all these things. You have to write all these things. Now you have to maintain a record of all these things. You have to maintain a record of first the procedure you will be following. You have to maintain a record of pre-installation. You have to maintain a record of installation qualification approved and signed by both the lab and the company. Maintain a record of operational qualification. whatever test has been done in that, whatever raw data has been done in that, you can check that, then go for performance qualification. Whatever you have been verified, the manufacturer's claim, what is the passing criteria you have used for it, maintain a copy of that. Whether you are following CLSI guidelines, whether you are following RICOS and CAMIN, for any equipment, any small or major equipment, whatever guidelines, regulatory guidelines available and you are following, keep a copy of that. Then whatever studies has been done, whether it is a precision study, accuracy study, BRI verification, linearity verification, carryover study, inter-instrumental correlation, interlab comparison, whatever you have done for that analyte, you can maintain a raw data of that. Always maintain the raw data and make a report where a comparison and achievement was shown that this was the mean, this was the standard deviation, this was the coefficient of variation which has been achieved. And this is what was the manufacturer's claim, whether it is, let's say you are achieving 6.8 and manufacturer is achieving 5.2. So it means you're a little higher. So keep that parameter under observation for few more days before passing that report. But if they have claimed it 5.2 and your achieving is 3.2, it's okay, it's acceptable. But if 6.8 and why the variation is more? Why it means standard deviation is more. Why the deviation is more than what has been claimed by the manufacturer? Keep the parameter under observation. Once it is through, then approve it. Otherwise, till then, don't approve it. Tell the company to do a use a comprehensive protocol for that analyze. For any, let's say for this is what I'm talking about, the most commonly used parameters. Sometimes there is a rare parameter for which many things are not available. No CLSI guidelines because it's a recent parameter. Only a qualitative test is that positive and negative. Then just follow the protocol. Whether it is matching to what has been claimed. If it is a genetics test, you cannot do a comprehensive protocol. So what all you can do, you mention it according to your requirements, according to the requirement of the test in your procedure and follow your procedure. So standard says you have a procedure and what you have said, you have to follow it. Always ask for the training certificates or some letter which says that these persons have been trained and they can work on those equipments. Find out the key operators who can talk to the engineers and can troubleshoot whatever is coming on day-to-day basis. Then compile the data to whom then authority was given of performance qualification of BRI verification and precision, accuracy, and linearity, whatever you have performed, just compile the entire data for each analyte and approve it. Review it and approve it. If it is okay, approve it, sign it, and then keep a record of it. And it should be kept. Next slide, please. So what I say is, when we are installing anything, when we are keeping it, our aim should be that we need to be extra careful so that when we are reporting the patient samples, then the report should be correct. The behavior of the equipment should be correct. There should be no random variations in the equipment. We can save someone's life because we are in that industry, we are in that healthcare industry where people trust on us. So we have to follow the protocols. These protocols are meant for a smooth working of the lab and the equipments. Next slide, please. So it's important at the end of this presentation, I will say Thank you to everybody. Any questions?